Welcome, and thank you for attending the second information session from the Provincial Bariatric Surgery Program. The purpose of this one-hour webinar is to provide you with all the diet and nutrition information related to the sleeve gastrectomy that will help you decide if this procedure is indeed right for you, and if so, to provide you with the information you need to continue the process and to achieve your greatest success. Some of the topics that we will cover today in this webinar include why the diet is so important and some of the key nutrients impacted by bariatric surgery. To review your pre- and post-surgical diets with a focus on the full fluid and the healthy eating or maintenance diet. To explain the importance of daily food journals and review how to keep complete and accurate journals. To review some of the common complaints or issues you may experience following bariatric surgery, and to outline what you can do next if you do decide to proceed. So why do we talk about diet and nutrition so much? Removal of up to 80% of the stomach results in a significant anatomical and physiological changes that lead to a whole new way of eating, and this change is indeed for life. This surgery results in a whole new relationship with food. This surgery also leads to potential nutrition deficiencies due to the changes in the way food is digested and absorbed. This, coupled with pre-existing nutrient deficiencies that we know are demonstrated in many bariatric surgery candidates, leads to an overall significantly increased risk of deficiencies of nutrients, such as vitamins and minerals. For this reason, it is critical to have a very clear understanding of diet requirements to minimize the risk and understand the significant changes of this new way of eating that are necessary for health and well-being after bariatric surgery. The key nutrients that are impacted by bariatric surgery include protein, calories, fluids, and multivitamins and minerals. These are the most important nutrients we will discuss today because you will need to be very aware of these nutrients for the remainder of your life. The first nutrient we will talk about is protein. Proteins are part of every cell, tissue, and organ in your body. We do not store protein in the body. Therefore, if you do not provide your body with enough protein from food, the body begins to break down its own tissues, such as your muscles, to meet its protein requirements. Your protein target after this surgery is a minimum of 60 grams for women per day and 80 grams for men per day. It is okay to go above these numbers, but never below. The role of protein in the body includes promoting weight loss, helping prevent hunger or increasing your satiety or feeling of fullness, helping with healing post-surgery. Proteins are part of the immune system. Protein maintains your energy levels. It helps minimize hair loss and helps promote regrowth of hair. It is very important to understand the sources of protein in your diet. So please make note, this is a key piece of information regarding proteins. You must be aware of where protein comes from. Your sources of protein include meat, such as beef and pork, fish, poultry, such as chicken and turkey, eggs, dairy products, such as cheese, milk, yogurt, as well as legumes, such as beans and lentils, and nuts and seeds. The next nutrient we talk about is calories. Ensuring your calorie target is met is key to promoting weight loss. Meeting your target is difficult at first due to the limited space in your new and smaller stomach. Therefore, it is important to make the most nutrient-dense choices possible. Your target for calories is approximately 12 to 1,500 calories per day. Where you get these calories is essential to safe and sustainable weight loss. Always choose quality, for example, lean proteins, vegetables, fruits, and small amounts of whole grains to meet your calorie needs. That is, choose quality over quantity, and always avoid excess calories from excess fat and sugar, refined carbohydrates, and highly processed foods that will fill up your space but provide you with minimal nutrition. The third key nutrient to be especially aware of is fluid. Your minimum requirement for fluid is 2 to 3 liters per day. This is an essential nutrient to maintain your hydration. Be sure to include all fluids consumed, including not only your water, which should be the majority of your fluid, but don't forget others such as milk and soup, juice, etc. Dehydration and rapid weight loss can lead to significant problems, including gallstones and kidney stones, for example, so always be aware of the signs and symptoms of dehydration, especially in the early post-op period, and present to your emergency department if you think you are dehydrated. Some of the signs and symptoms of dehydration are noted here on the slide, so please make note and, as noted, present to your emergency room if you believe that you may be dehydrated. Finally, it is important to talk about vitamins and minerals. Due to the limited capacity of your new stomach and subsequent changes to digestion, as well as the physiological changes such as the change in acid environment of the stomach, this leads to a decreased ability to meet your needs for vitamins and minerals, and can lead to increased risk of deficiency, which can lead to serious medical problems, including neurological damage that, if left untreated, can be irreversible. It is therefore critical to commit to taking your multivitamin and mineral supplement every day for life, plus any others that may be required. Your blood work will be monitored for potential deficiencies, therefore it is critical to have your blood work completed as requested prior to your clinic visits. Some of the potential nutrients that may become problematic after bariatric surgery include those noted on the slide, including vitamin B12, vitamin D, iron, thiamine, and others such as calcium, vitamin A, folate, zinc, copper, protein, fluid, and many others. Again, your nutrition status is monitored closely via your blood work, and it is always critical to make sure that you are taking your multivitamin and mineral supplements as requested, and it is critical to have that blood work done prior to your clinic visits as requested. So here are some samples of multivitamin and mineral supplements that you could potentially choose. These are just samples. There are many, many others that you could choose. You will see here that there is a chewable form available, the Jameson chewable multivitamin. This is a form that is often required or often used for the first several weeks after your surgery, and then you progress on to the pill form after about your first month. We'll talk about this a little more further on in this presentation. So let's begin to examine how your diet will change and progress throughout the process of bariatric surgery. The following 3 slides provide basic information regarding the diet changes around your time in hospital and in the 4 to 8 weeks following your surgery. Following this, there will be slides providing more detail on the full fluid diet, and then more detail about the maintenance or your lifelong diet that you will ultimately follow after you've transitioned through all of your post-surgery diets. Note that before you ever reach the surgery stage, you will have completed 2 weeks of diet trials. 1 week of the healthy eating diet, which prepares you for your lifelong or your maintenance diet after your surgery, and 1 week of the full fluid diet. So you will have experience with both diets prior to your hospital admission. In hospital, you will follow the following program. Initially, you will have nothing to eat or drink after your surgery. You will begin to start sips of clear fluid, either on the morning of your surgery or possibly even the evening of your surgery. The progression that you follow is directed by the nursing staff on the floor, and it usually begins with a small amount of water and then clear fluids. You begin with 1 ounce per hour and progress to a goal of 4 ounces per hour. Once you reach the goal, you will transition back to the full fluids, within the first, usually 24 hours after your surgery. Remember that prior to admission, you will be given direction regarding the diets you will need to follow in the weeks and days before you come to the hospital. And once in the hospital, and once your surgery is complete. After your surgery, once you have progressed beyond your 4 ounces of clear fluids per hour and you are tolerating this well, you will be transitioned back to your full fluid diet as per the nursing instructions. You will follow the full fluid diet for 4 weeks after your surgery, and if this is tolerated, you progress to the next stage, which is the soft diet, which again you will follow for 4 weeks after your surgery. If this is tolerated well, you then progress on to your lifelong or maintenance diet. And again, this is your diet for life. The serving sizes will vary from person to person. This is a very individual thing. Ultimately, you should progress to approximately a maximum capacity of 1 to 1.5 cups. But again, this is very individual and differs from person to person. So let's look at your soft diet. We're not going to go into too much detail because this is such a short-term transition type of diet followed for 4 weeks after you transition beyond the full fluid diet. You will be provided with guidelines for this diet in the hospital during your visit from the dietitian and nurse practitioner. The diet starts about 4 weeks after your surgery, again after you've finished your 4 weeks of full fluid diet. The soft diet is followed for 4 weeks, and it includes foods that are gentle on the stomach and easy to digest and moist. For example, scrambled egg, baked fish, ground meats, ground poultry, tofu, cheese, and mashed, soft-cooked vegetables. You'll notice that most of these foods are high in protein, which of course is the focus of all your diets. The serving sizes of the soft foods are generally smaller than your liquids. It is very important to make sure that you chew all of these foods well and eat very slowly. Take your time, listen to your body. And the key point as you begin to eat solid food after your surgery is to remember to separate your liquids from your solids. This means that you must have approximately 30 minutes separation between your solid food and any fluid intake. This is an important rule to follow and must be followed for life. When you begin the soft diet, you start generally with about 1 to 2 tablespoons and progress to approximately 1/4 to 1/2 cup of food. The post-op progression is essentially a gradual transition from sipping small amounts of fluids almost continually to an eventual pattern of 3 separate meals and 2 to 3 snacks per day. We are going to talk in more detail about the full fluid diet because this diet is required for at least 1 week prior to surgery, and it is your survival diet for the 4 weeks after your surgery. So again, as already mentioned, the full fluid diet is followed for the 1 week trial before your clinic visit, and for 1 week before your surgery or more, depending on the surgeon's directions, and again for 4 weeks after your surgery. Remember that you will have completed that trial of this diet as part of your preoperative education and preparation process. So why is the full fluid diet so important? Because it does prepare you for after your surgery. The diet trial is most important because this is your survival diet for 4 weeks after surgery. So you must demonstrate a good comprehension and understanding of the foods allowed and those not allowed, and the ability to meet your nutrient targets while following this diet. So the diet trial, the full fluid diet trial that you do before your surgery does prepare you for after surgery. You'll learn about protein, calories, fluids, and calculating your daily intake. You're able to sample products to determine what you like and what you don't like, and to stock up on those things that you will need after your surgery. Following this diet also promotes pre-surgery weight loss, as it decreases the liver size, which makes the surgeon's jobs easier. And this, of course, is always a positive thing. It also allows for healing after surgery. The full fluid diet allows for easy digestion while providing your nutritional needs. For example, your protein, your fluids, and your calories, as well as your vitamins and minerals with your supplements. This slide demonstrates the foods that are recommended on the full fluid diet and not recommended on the full fluid diet. I won't go through each and every item within each of the categories, but please do make note. The guidelines will be provided as an attachment to the email with this webinar, so please review it carefully. This diet does include both clear and full fluid diets that must be thin. For example, use fluid milk as a guide. The fluids must contain no pieces or chunks. You may therefore need a blender and or a strainer to ensure the proper consistency. Please note that this diet does not include blended whole foods such as fruit with seeds or raw vegetables. Blended and strained soups made from single ingredients such as lentils, peas, tomatoes, squash soup, etc. are all okay. But again, the consistency must be that of fluid milk, so quite thin. The goals for the full fluid diet remain the same as remain the same as the goals as already discussed for your diets. 60 to 80 grams of protein per day, that's 60 for women, a minimum of 80 for men. Again, you can go more than that, but never less. The goal for calories is approximately 1,200 calories per day. With the calories, people on the full fluid diet often do not achieve that goal of 1,200 calories. So my suggestion is to aim for at least 800 to 1,000 calories per day. To do this, you likely have to choose more items as tolerated to increase your calories. And of course, you need to meet your goal of 2 to 3 liters of fluid per day. It is critical to meet your needs post-surgery to promote healing and minimize muscle wasting and weakness. Again, a chewable multivitamin and mineral supplement is often recommended when you're on the full fluid diet for the 4 weeks post-surgery. However, it is not 100% necessarily. It is not always 100% necessary. This recommendation can be adjusted based on individual tolerance. We're going to take a look at protein powders because they are critical on the full fluid diet due to the limited capacity post-surgery, which makes it very difficult to meet your protein targets via foods alone. Again, recall your protein target is 60 to 80 grams every day. There are a wide variety with a variety of protein sources available when it comes to protein powders. Some of the protein sources include whey isolate, whey concentrate, casein-based formulas, soy-based formulas, egg-based formulas. These are all good sources of protein. Ideally, the whey isolate is recommended because it is the most concentrated, fastest and easiest absorbed, and most purified. That is, it is generally lactose and sugar-free and provides 100% of the amino acids that your body requires, which are the building blocks of protein. Of note, here it is important to avoid collagen-based protein powders because these do not have all of the required amino acids and are therefore not complete proteins. Some other things to look for in a protein powder include not only that it is whey isolate based, but also that it contains less than approximately 5 grams of sugar, approximately 20 to 25 grams of protein per serving or more, and somewhere less than or about 150 calories per serving. A little more on protein powders. Protein supplements come in both powdered form, as discussed, which can be flavored or unflavored. Protein supplements also come in premixed form. The powders can be added to things such as soups and yogurts, jellos, puddings, hot cereals, etc. to help boost the protein content. And of course, the premixed are available in a ready-to-drink form. These can also be used to make smoothies, for example, with added yogurt. And once you move beyond the full fluid diet into the soft diet, you can begin to add some soft fruits and veggies and so on. So where do you find these protein supplements and protein powders? It is very critical to trial different forms and flavors prior to your surgery, for example, in your diet trial, to find one that you know you can rely on after your surgery is complete. Some of the places you might look for include Costco, Walmart, the grocery stores, drugstores such as Lawton's and Shoppers Drug Mart. Health food stores carry a wide variety of different protein powders and supplements. You can also order them online at Costco. Again, the health food stores such as GNC, they're available at Amazon. And of course, there are a wide variety available on different sites that are available in the US as well. What are some other sources of protein in the diet on the full fluid diet? When on the full fluid diet, you can include skim milk as a source of protein to boost, skim milk powder as a source of protein to boost the protein content. But a note about skim milk powder, it can be used to boost the protein content of many things, such as dairy products, for example, milk and yogurt, but it does not provide as much protein as protein powder supplements, and therefore should not be used as your sole or only source of extra protein in the diet. Other sources of protein on the full fluid diet include your low-fat dairy and alternative beverages such as soy beverages, kefir. It also includes such things as part skim ricotta cheese or cottage cheese, plain or soft tofu, and yogurts. Greek yogurt, of course, has more protein than a regular yogurt, and I'll just demonstrate that here on the next slide. If you compare your Greek yogurt, you can see that the plain Greek yogurt here contains approximately 20 grams of protein for every 175 gram serving. On the right, the Activia or plain regular yogurt, non-Greek yogurt, contains only 4 grams of protein per serving. Now, note that the serving sizes are different. So if you were to compare the equivalent serving size of the Activia yogurt and bring it up to that 175 gram serving, you would still be only getting about 6.2 grams of protein in a 175 gram serving. So you can see that it is much less protein in the regular yogurt than you would find in the plain Greek yogurt. A note about yogurts is that flavored Greek yogurt is okay. Just be aware that it does have a little more sugar, therefore a little more calories, which tends to reduce the protein slightly. It is still okay, though, to include on your full fluid diet. I want to make a note here about meal replacements. These are different than whey protein supplements. Meal replacements include such things as the Carnation Instant Breakfast or Carnation Breakfast Anytime, Special K Shakes, Slim Fast, Boost, Ensure, High Protein Ensure, Diabetic Boost. All of these things are meal replacements. They are often a blend of different types of protein, whey, casein, and or soy proteins to enhance their flavor. They do have a much higher sugar content, which decreases their protein content and increases their calorie content. So the protein to calorie ratio from these is not as favorable as a whey protein isolate supplement. These are meant to supplement or replace meals in diets that include a variety of other foods, which is not the case in the full fluid diet. Therefore, they are not appropriate as a sole protein supplement on the full fluid diet. They can be included as additional items on the full fluid diet, but should not be used as your sole protein supplement on the full fluid diet. Remember, always look at how much protein you are getting in relation to how many calories you are getting. And you will find with the meal replacement supplements that you are not getting as much protein and getting much more calories than you would in a plain whey isolate protein supplement. So the second most important diet that we will talk about is after your surgery is your lifelong or your maintenance diet. This is, as I said, your lifelong or your diet for life. Again, remember that you will complete a trial of this diet prior to your surgery that will help you prepare and understand the appropriate food choices, which foods to avoid, the meal pattern, etc. This diet, your maintenance diet, includes regular textured foods. The serving sizes vary from about a half a cup to 1 cup of solids per meal. Again, this varies from patient to patient. It can be more than that. Long term, the amount of food per meal again is about 1 cup or more. The focus of this diet is on healthy eating. This diet happens about 8 weeks after your surgery if there are no major complications. So let's talk about the healthy eating diet trial. So this is your first attempt at healthy eating. This is the diet that is required prior to surgery. First, we'll examine the healthy eating diet trial that you will be required to do prior to surgery. Then we will examine in more detail how that translates into your lifelong or maintenance diet after your surgery. Again, the guidelines for the healthy eating diet trial are provided as an attachment with this webinar's email. The purpose of this trial is not to find fault, but to introduce you to the diet guidelines that you must follow postoperatively. This trial allows us to assess your commitment and ability to make changes, to highlight the positive changes you are able to incorporate into your diet, and to identify your ability to understand and meet your nutrition targets. It does not have to be perfect, but does have to demonstrate improvements and effort to make changes. It does demonstrate your commitment and understanding of how to complete food journals and provides you with an opportunity for self-reflection, as this is a huge change and a huge lifelong commitment. The healthy eating diet trial, again, includes basic healthy eating principles, such as eating regular meals with 2 to 3 planned snacks, so no skipping meals, limiting your junk food, in quotations I say junk food or unhealthy foods, and limiting your takeout, watching your calories with a goal of about 12 to 1500 calories, making sure that you're meeting that protein requirement of 60 grams for women per day, 80 grams of protein for men per day or more. Again, meeting that 2 to 3 liters of fluid, limiting your processed foods, increasing your fruits and vegetables, always eliminating the pop, caffeine, and alcohol, so eliminating all the carbonation. And again, this is a commitment for life. Once your trial is complete and submitted, I will provide you with feedback on your diet trial to help you as you continue on with this diet. But it is critical that after you complete the trial, you continue to follow this diet and continue to complete your daily food journals. This is a lifelong commitment that begins with this diet trial and doesn't stop. So what exactly does that healthy eating diet look like after surgery? Once you've completed your trial, that's your introduction to the diet. After surgery, you must continue to follow these guidelines for the healthy eating diet. However, the gastric sleeve procedure does limit the quantity of food you can eat and how you eat it. So you must meet your nutrient targets for protein, fluid, and calories within these new limitations that the gastric sleeve creates. So this slide demonstrates the ideal meal pattern you will need to follow to meet your nutrition targets and to tolerate the diet within the restrictions of your new sleeve. As you can see, it includes 3 meals per day, breakfast, lunch, and supper, plus 2 to 3 snacks per day, depending. Initially, most people do require 3 snacks per day. Over time, that may be reduced to 2 if you're able to meet your requirements within those restrictions. So your day looks like a breakfast meal with at least 20 grams of protein, a lunch meal with at least 20 grams of protein, and a supper meal with at least 20 grams of protein. And again, 1 to 2 snacks. Each of these also should include small amounts of protein so that by the end of the day you've met all of your requirements for your protein. It is important to make sure that you don't go for more than 3 to 4 hours without eating a meal or snack, and to eat within 1 hour of waking. This slide I know seems very busy. This is a slide that demonstrates all of the guidelines for your post-surgery maintenance diet or your lifelong diet, which is basically your new way of eating for life. So the summary of the guidelines for your lifelong or maintenance diet are provided here. I'm not going to go through every single one, but I will ask that you look at this slide in detail to make sure that you understand exactly what it is that your maintenance diet will look like after surgery. Some of the things that I will point out is that it is important to always make sure you get that protein that's required. Each meal should include, as noted on the previous slide, approximately 20 grams of protein per meal. That's about 3 ounces of meat, for example, at your lunch and supper meal, and then 20 grams of protein at your breakfast meal through other sources. It is important to try one new food at a time and to eat slowly, chew all of your food well. Make sure you don't skip meals. It is also really important to remember not to drink your fluids with your meals, to separate and have at least 30 minutes before your meal and 30 minutes after your meal without drinking. Take small bites of food. Using small plates and small spoons can help. Monitoring your portion sizes very carefully, so sometimes this requires a food scale or measuring utensils. And again, of course, avoiding, the high-calorie snack foods, the highly processed foods, avoiding the alcohol, caffeine, and carbonated beverages as previously discussed, limiting the amount of fruit juice that you drink because of the calories that it contains. A half a cup per day maximum is recommended, and of course limiting other high-calorie, sugar-sweetened beverages, and avoiding, again, those processed, highly refined carbohydrate foods. So how do you build your meal based on all of those very strict requirements? This slide demonstrates how to translate all of that information into actually building a meal. Basically, you start by eating your protein foods first. You can see that this is the largest portion of your meal, and again, your goal is approximately 20 grams of protein per meal, which is about 3 ounces of meat, which is again about the size of a deck of cards. This then is followed by your vegetables, which ultimately your goal is to aim for approximately a half to 1 cup of vegetables or more per meal. And following this is your small amount of fruits and small amount of whole grains. What does that look like on a plate? This plate shows you what this meal would look like. This plate is approximately 7 inches in diameter. It holds about 1 cup or more of food made up of your 3 ounces of meat or 20 grams of protein foods, 1/2 to a cup of veggies, plus your small amounts of starchy type foods, whole grain foods, which is approximately 2 tablespoons or about 1/4 to 1/2 a cup of starchy whole grain foods. Remember, bariatric surgery is only one tool in the management of obesity, which, as you know, is a chronic and progressive disease requiring lifelong management. You have and must use other tools, including your food journals, which keep you accountable to your healthy eating diet, and your regular structured physical activity to manage this disease. Just like any other chronic disease, such as diabetes, hypertension, if you only rely on one tool to manage your disease, you will have limited success and your disease will come back. The sleeve gastrectomy does not change your ability to make unhealthy food choices, which will ultimately lead to limited success and eventually to weight regain. You still must avoid high-fat, highly processed foods, highly refined carbohydrates and sugars. You must commit to following the diet guidelines, keeping daily food journals, and exercising regularly to achieve the most success. So let's talk more about food journals. Food journaling and finding nutrient information, this is one of those tools. In fact, it is one of your most powerful tools, and its importance cannot be understated and underestimated. So we have talked about so talked so much about the importance of meeting very specific nutrient targets. Therefore, we need to know where and how to find the nutrition information you need to know if you're meeting these targets. Remember, this is one of your most powerful tools, keeping a food journal. And the most successful people who go through this program are those who keep food journals every day for life. Before surgery, you must continue to keep your journals even after you've submitted your healthy eating and full fluid diet trials. This demonstrates your understanding and commitment to this very important lifestyle behavior. After surgery, your journals help you know and understand what you are eating and if you are meeting your targets or if you need to make any changes. So let's look at what keeping a journal looks like. Again, it is part of your self-monitoring and is key to your success. It is important to know and understand journal information. You can use paper to record food journals, or you can use electronic versions such as MyFitnessPal or others. So when do you journal and what do you include? Well, you keep food journals every single day for life. What to include on your food journals? You include all of the food and the fluids that you consume. You include the time that you consume them and the amount. In addition, you must include for every single food and fluid consumed the amount of protein and calories that is provided by each food and fluid consumed. It is critical at the end of the day, at the end of your journal, to provide the totals for your protein, your calories, and your fluid. This is the only way to know if you have met your targets. So where do you find nutrition information? First and foremost, you find nutrition information on the nutrition label, which is found on all foods, packaged foods that have nutrition labels provided. How do you read a nutrition label? The first and most important thing to do is to look at the serving size, because all of the nutrition information provided on the label is based on the serving size indicated. If you eat a larger or smaller serving, then you must be able to do some basic math to figure out how much of a particular nutrient, for example protein or calories, you actually consumed. If you are unsure how much food you've eaten, for example what your serving size actually is, then you may need food scales to help you measure so you can do appropriate calculations. I would highly recommend purchasing a set of kitchen scales, since eyeballing, in quotations, or guessing how much you've eaten is rarely accurate and can lead to inaccurate information on your food journals. Another source of information, of nutrition information, if a food does not have a food label or a nutrition label as previously indicated, can be from online sources or books or booklets. This particular booklet or slide demonstrates nutrition information that can be found in a booklet called Nutrient Value of Some Common Foods. You can see that in the top left-hand corner of the slide. This booklet can be downloaded from Health Canada's website. It is free of charge, and it provides all of the nutrition information that you would require for foods, as I said, that don't have a nutrition food label. For example, a banana or an apple or a slice of a piece of salmon, for example. These foods don't always necessarily come with a nutrition label, therefore you must have some other way to find the nutrition information for that food that you're consuming. An egg, for example, if you didn't have access to the nutrition label, you could always look it up in this booklet or some other online resource, and you can see here that you can find the type of egg that you ate, the energy or the calories, the protein, the carbohydrate, the fat, and so on, and all of the vitamins and minerals that go along with it. Again, remember, finding accurate nutrition information and keeping accurate food journals is key to your long-term success. Your Your food journals are one of your most powerful tools available to you in the management of your chronic disease. We are going to talk a little bit now about some of the nutrition problems that you may encounter after surgery. I'm not going to go into too much detail regarding this because not everybody experiences problems, and if they do, everybody's experience will be slightly different. There are some common food intolerances that I will mention because these are foods that are commonly not well tolerated, often for life, but especially in the first year after surgery. The most common intolerances include the first two on this list: your tough meats, so any dry, tough, or rough meat, for example, barbecued meat. Doughy breads, rice, and pasta are also foods that are generally not well tolerated. Other foods that some people may or may not have difficulty with include fried foods or high-fat foods, high-sugar foods and beverages, raw vegetables, the membranes of some fruits such as orange and grapefruit, and the seeds and skins of some fruits as well. Raw veggies and fruit, etc. do become easier with time for most people. Nausea and vomiting is again not an uncommon complaint after surgery. It is not necessarily, though, experienced by every patient, and it is usually the cause is usually easily identified. You can look at, if you're experiencing nausea, whether you've eaten too much or eaten too quickly, if you're eating and drinking at the same time. These are usually the common causes of nausea and vomiting. It can also occur if you progress your diet too quickly before you really are comfortable or before you should. It is important to recognize, though, that you should not be vomiting often, and if you are, you must be in contact with us or your family physician, or go to emergency room if you're experiencing it very frequently, to make sure that it is examined and to find out how it can be dealt with and to avoid dehydration. Other complaints that some people may or may not experience and what you can do about them. So again, looking at the nausea and vomiting. To help with nausea, again, important to slow down when you're eating. Make sure you continue to drink your fluids between your meals, not with your food. Again, giving yourself that 30 minutes before your meal. Before you have your meal, you need 30 minutes. And then take 30 minutes to eat your meal, wait 30 minutes before you start drinking. So there's your separation of your liquids and solids. If vomiting occurs, again, take a closer look at what preceded the incident. How much and what type of food or fluid did you have? How quickly did you eat it? Did you chew it well enough? Were you distracted and ended up eating too much? And again, making sure those liquids and solids are separated. You can see I've repeated that multiple times. It's very, very important. Constipation and diarrhea can be issues for some people. Constipation often occurs early after surgery simply because drinking enough water can be difficult. You generally have a fairly low fiber intake in the first 4 to 8 weeks after your surgery, and if you have a history of constipation. Diarrhea is not as common after this time of surgery, but it does occur. If so, sugary foods or sugar alcohols, which are artificial sweeteners, are sweeteners that end in OL. For example, maltitol, sorbitol, xylitol. These are sugar alcohols that, if you consume too much of these, can lead to diarrhea. What can you do if you do experience constipation? First and foremost, make sure you're drinking plenty of water. You can exceed the recommendation of 2 to 3 liters, but always be careful not to be below that 2 to 3 liters of total fluid. Make sure you keep moving and exercising, important for managing constipation. And again, try and add as much fiber as possible, making sure, of course, that you're meeting your fluid requirements. So some of the sources of fiber that you could include once you move beyond your full fluid diet include beans and lentils. Benefiber, Metamucil, ground flax, Restoralax, these are all things that could be used throughout your full fluid diet as well. If you have no results or no improvement with any of these solutions, then you may need some help with over-the-counter medications such as a stool softener. So it's important to be in contact with your bariatric surgery team if you are having trouble and can't relieve the constipation. Gas, of course, is another very common complaint after surgery. It occurs mostly in the immediate post-op period because of the gas that's introduced into the system during the surgical procedure. The most important thing you can do to help alleviate this gas, which often causes a significant amount of pain after your surgery, is to get up and walk around as much as possible. Avoid introducing any extra gas into the system, so that means avoid chewing gum, not drinking through a straw, and of course not restricting your fluids. Again, I will emphasize that getting up and moving and walking about immediately after surgery is the most important thing you can do to help alleviate this problem. Anorexia, this is just defined as a complete lack of appetite, which causes people to forget to eat, and this is a problem that patients do experience because remember that we have taken away your hunger hormone, which is which drives you to eat. So it is essential that you make the effort to make sure you're consuming adequate food and fluids throughout the day. This may mean mechanical eating, for example, or eating by a clock, setting a schedule, setting an alarm to remind you to eat. Remember that restricting too much, restricting your calories and your intake too much can interfere with your weight loss efforts and lead to nutrition deficiency. So it is important to set those reminders to help you remember to eat your 3 meals and 2 to 3 snacks every single day. Hair loss is a common occurrence after this surgery. It occurs because the shock of rapid weight loss and the surgery itself is seen as a stress to the body, which can lead to hair thinning and hair loss. It can also be due to a low protein intake, so again, meeting that protein intake is critical, and due to micronutrient deficiencies such as zinc, for example. Hair loss is not preventable, but it can be minimized by, of course, ensuring that adequate protein intake and ensuring that you are taking your multivitamin and mineral supplements regularly every day as prescribed. Heartburn or reflux is another common problem after the surgery. Some people, the gastric sleeve creates reflux, unfortunately. For others, it takes it away. Everybody is very individual. Some of the causes of reflux after surgery result from the fact that you have a very tight space. So you have decreased gastric compliance, or as I said, a very tight space that's very tense. It's almost like a lead pipe. That increases the pressure in your stomach is increased, and you have a valve at the bottom of your esophagus. With the increased pressure in the stomach and the pressure in the valve at the bottom of the stomach tends to be a little bit lower because of the shorter abdominal length of the lower esophageal sphincter pressure is lower, and the shortened abdominal length of the esophagus leads to an environment whereby reflux is very common. What can you do about reflux? It's important not to eat too much volume. It's important not to eat too quickly. It's important to remain upright after eating, and it is critical again to separate those liquids and solids. So now that we've reviewed the entire nutrition regime, including your diets pre-surgery, your diets post-surgery, what all of those diets look like, this is a time for you to do a little self-reflection and look at the fact that this is not an easy commitment to make. It is a lifelong commitment, and it is difficult. It includes many difficult behaviors that are required for life. For example, your food journals, healthy eating, so including 3 meals and 2 to 3 planned snacks a day with no skipping meals. It includes no carbonation, no alcohol, no caffeine, at least 12 to 1500 calories a day, 60 to 80 grams of protein a day or more, with 20 grams of protein at each meal. It includes 2 to 3 liters of fluid a day. It includes taking that multivitamin and mineral supplement or others as needed. It includes making sure you don't eat and drink together, so separating those liquids and solids. That is a long list of very strict requirements that we're asking people to commit to for life. So this is a chance for you to really examine if you are ready to make that commitment. So on your first clinic visit, after you have completed your 2 diet trials and they have been assessed and your appointment with a nurse practitioner and dietitian has been booked, what can you expect? This visit helps us assess and measure your commitment and ability to follow the lifestyle changes, for example, diet and exercise. The visit is generally divided into 2 parts. The first half of your visit is generally with the nurse practitioner and the second half is with the registered dietitian. The nurse practitioner will complete an extensive review of your medical history, review your medications, and provide you with your multivitamin and mineral supplementation recommendations. The dietitian part of the visit involves a detailed review of your understanding and any issues with your 2 diet trials. We will review previous attempts at weight loss and lifestyle changes and the successes and challenges that you had with those. We will review your previous eating patterns and identify problematic eating behaviors and help find ways to manage these. We will also discuss your ability to cope with your new relationship with food and your new way of eating. So what's next? What we ask of you now that you've reviewed this webinar is to start making those changes today. Start your food journals and don't ever stop. Complete your 2 weeks of diet trials, 1 week of your healthy eating and 1 week of your full fluid diet, and submit them to us. Your healthy eating diet should begin to include some of those principles that we talked about regarding the healthy eating changes. You should also begin to increase your daily physical activity. Some of the healthy eating principles that you should be including as you begin your healthy eating diet trial include reducing with a view to eliminating all of your caffeine, all of your carbonation, all of your alcohol. Increasing your fruits and vegetables and your low-fat dairy intake, so your milk and yogurt and cheese, your dairy products. No skipping meals, making sure you're eating 3 meals a day with those 2 to 3 planned snacks if needed. Avoid grazing. Limit your eating out, especially fast food. And if you do, make sure that you're trying to make healthier choices. Making sure you get rid of some of the foods that tempt you in your environment. If human self-control is not infinite, it is limited. So if your environment if you are surrounded, by foods that are tempting, that you know you have limited control over, then the best approach to helping manage that is really to eliminate those foods. Get rid of those types of foods in your home. Eat mindfully. Make sure you're not distracted when you're eating. Start taking your multivitamin and mineral supplement. Try some of the protein supplements so that you know which ones you like and which ones you tolerate. And of course, meal preparation and planning is so important. So plan ahead, make grocery lists and for prepared meals. Remember, at your first visit, we use this as a tool to measure your level of commitment. If you do not demonstrate commitment to continued food journals and daily physical activity, we may have to delay booking your surgery. If, after viewing this webinar, you decide you do not wish to proceed with surgery, please contact us immediately so that we can update our files. Otherwise, we will expect to receive your 2 diet trials within 30 days. This concludes the information session on nutrition and diet for bariatric surgery. Thank you for your time and interest in participating in this webinar. Please do not hesitate to contact the bariatric surgery office if you have any questions about anything you've learned today. We do look forward to hearing from you, whether you decide to proceed with surgery or not, within the next 30 days. Thank you and have a great day.